Okay, good morning, everyone. I'm really excited to see you all here in person and online. If you have any questions for those in the online audience, please go ahead and post them in the Zoom chat, and we'll get started. So my name is Sandesh Dave, and I want to welcome you to this workshop. I'm the director at Institute for Future Health and Cardiovascular Projects. I'm a cardiologist at the Southern Arizona VA healthcare system. These are my disclosures. Why is this workshop important? I think just looking at the scale of Veterans Healthcare Administration, it's the largest integrated healthcare system in the United States, and there's over 1,000 healthcare facilities, 172 medical centers, 1,000 plus outpatient sites of care, serving roughly 9 million veterans per year. So a couple sort of general comments and perspectives I wanted to share with you, and then we'll get into our talks. So you're going to hear about working with VA, collaboration opportunities and entry points. You're going to hear about VA data resources, Vinci. You're going to learn about the ARCHES and MD Clone data platform. You're going to hear directly from investigators who are working with VA data from University of Arizona, ASU, and VA. And you're going to hear from our VAs about how to partner with them. You're going to hear more about other types of VA data resources. And we're also going to hear from our universities about their interests and needs and how this could potentially go forward. From a clinician perspective, clinicians, I think, are naturally curious, like all of us. And, by being able to access data themselves, we can rapidly answer questions and generate hypotheses. Last night, as I was preparing this talk, I thought, well, let me just try something myself and see if this is really true. And so I went into the system and I said, how many VA patients nationally have been treated for hereditary ATTR polyneuropathy? And I found the answer in less than 2 minutes. Now, that wasn't a full study, obviously, but that was very powerful. That data might be available to, let's say, a national pharmacy program manager or a local pharmacy manager. But that data is typically not available to clinicians themselves. So I think this is really an important self-service model, which is what we're seeing right across society. And it's, I think, the difference between an ATM and a bank teller. And so from a clinician perspective, this can support quality improvement and program building, right? So if you want to design a program for patients with high cholesterol or aortic valve stenosis, you can start to generate some numbers and begin thinking about this immediately. And also some of your ideas may be percolating, and you may not get an answer with a single ticket into informatics. You kind of want to generate your ideas iteratively. It's not a simple request. From a researcher's perspective, I think some of the advantages of the platforms you're going to hear about today is that they do not require studying extensive data dictionaries. That's not to say that everything is immediately interpretable to someone who's not familiar with VA data, but one can get started relatively quickly. And obviously, understanding healthcare data is still important, but there's no database programming skills that are immediately required. There is, I think, a strong user support system with some of the newer platforms that you're going to hear about today. The functionalities are constantly improving, and I personally can't keep pace with them, but things are constantly in flux. So something I see that's not possible might be possible later. The approval process to access data is pretty fast. Once you have, in my case as a researcher, IRB approval, the data access is almost instantaneous within a matter of days. However, not all types of data are necessarily accessible by some of the platforms you're going to hear about today. So, things like Medicare data, progress notes, They may not be currently available. You're going to hear more about structured data today. And currently in the VA Arches environment, there's limited software for statistical analysis. I believe R and other packages may be available, but things like SAS, it's sort of a bring your own license approach, and I think that can be a challenge. So in terms of my interest as a researcher in cardiology, a lot of the areas that our group is interested in can be answered with the CDW access, corporate data warehouse access. So issues around clinical epidemiology, outcomes research, disease prediction, quality of care, quality improvement interventions, or at least planning for them, comparative effectiveness, costs of care. So I think this is a very intriguing platform that the VA is providing. I want to just briefly mention VA data challenges. This is not something that I'm particularly knowledgeable about, but this came to my attention. The VA, in collaboration with FDA and UK, sponsored the Cardiac Health and AI Model Prediction Challenge, VCHAMPS. And I passed this on to one of our cardiology fellows at University of Arizona, who himself is a data scientist, Jeffrey Tran. And we connected him with a data scientist in VA and another budding data scientist. And this small team of 3 people competed for this international challenge. And as I was looking at the website, approximately 16 countries were represented, 123 people were part of those teams and submitted to that challenge. And most of the winners seemed to be within industry, and our team actually did not win. But the point is that they competed and they learned a lot of important lessons. And I think that this could be very powerful for universities and data scientists if they're interested in getting involved with VA data. So from an education perspective, this is something that I think we need to really creatively think about, and this is something that I think needs to be discussed more. So I think that students, so medical students, graduate students, residents, fellows, undergraduates, they have shorter time horizons. They have limited data analysis skills in some cases. They generally are, a team of 1 or 2. They have less experience with IRBs, and they have less experience with VA IRBs, naturally. So with VA Arches, I believe they can conduct impactful research and quality improvement if they have proper IRB support, if they have some statistical support depending on their level, if they have credentialing support with VA, if they have some training on the data platform. So I don't think that they can do this themselves, but with a little bit of support, they can be off to the races. And from a perspective of industry, I think that there's a lot of real-world evidence here, and if someone is interested in the entire veteran experience, in many cases they will be interested in Medicare data, and so that's an important linkage that might not be accessible through some of the platforms we're talking about today. However, that's not always the case with every research question. And veterans are primarily males, and so the research has that perspective. But many diseases are prevalent in males and females. Take the case of prostate cancer, heart failure, ischemic heart disease, hypertension, etc. And I think I haven't really seen a lot of research coming out of VA that partners with industry for this type of work. So a couple other interesting tidbits. As we were doing some of our large-scale data work trying to answer heart failure questions, there were questions around the validity of some of the underlying data. What is the meaning of this ICD code? Does it really relate to the disease of interest? Things like that. So we were looking at VIREC website, and we found Voogle, which is a Google-like resource in which you type in the patient's name or data identifier, and you type in the concept of interest. So in this case, the example is diabetes. And so it pulls up all of the mentions of diabetes within that patient's record. And so one can then systematically go through this longitudinal patient record and find out all mentions of that particular disease. And then one can actually go into the note. And so one can sort of validate these concepts that we're trying to develop. And this was something kind of unknown to me. I'd never really heard about this before. And so my point is that there's a lot of tools out there, if people know, if people are trying to answer specific types of questions. Similarly, we're looking to do a national chart review, and the Capri application, which was actually created around compensation and pension records, it actually supports now research functionalities. And so we're hoping to do a national chart review using Capri. And full disclosure, it's taken us roughly 4 months to get approval to use this platform. So it's not been a rapid process, but we were approved. So, and I think I just gave you an example of where you can do large-scale data analysis, but you can also do really individual level, patient record extraction. So it's something that you wouldn't necessarily get from a Medicare data set, right? You cannot directly link to individual patient records. You only have codes and claims. Now, in terms of barriers and opportunities, I think that, if we want to scale from individual researchers, individual students, there will be some sort of investment needed to centralize some of the resources to accomplish these things. Regulatory approvals are challenging. They are possible, but they really require people with experience, VA experience, understanding of VA regulations. And then I think, VA credentials and training must be kept active. I have to confess, I brought on a researcher once from a university, and I don't think that we ever did a project together, and I'm pretty sure their credentials lapsed. And that's really, not a good use of their time or the VA's time. And so I think I learned a lesson there. But, in terms of opportunities, I think this is a gold mine of data, and there's really no cost to access the data. It's a public good. But we need more investigators. There's enough here to support 100 investigators or 1,000 in Phoenix, and a similar number in Tucson and other universities in Arizona and other entities in Arizona. This fills a genuine need for researchers and educators, in my opinion. And there's a massive scale. I believe we have access to 25 million longitudinal records with a complete EHR. That's very powerful. And it can be utilized for non-VA research, so NIH research, industry research. There's really no limit as to how you can use the data if you have proper approvals. And so